Welcome to South Texas Now, featuring Attorney Joe A. Flores from the Flores Law Firm. He grew up right here in the Coastal Bend and became a physician's assistant, fell in love with the law, and became a lawyer. Each broadcast of South Texas Now brings you unique interviews with some of the voices that make a difference right here in South Texas. Now please enjoy this episode of South Texas Now.
And welcome to another episode of South Texas Now. This is attorney and nurse practitioner Joe Flores, reminding you to join us each and every week right here on CBS, NBC, Telemundo. Bienvenidos a todos mis hermanos que hablan nuestro idioma español. And also KTMV with Carlos Lopez, his dad. I was his lawyer for a very long time. Humberto Lozano Lopez. He's honored, he's venerated, and he's never forgotten. Thanks you guys for giving me my start over 20 years ago. Well, we've got a lot to cover, and first of all, I want to give a big shout out because this is primarily dedicated to seniors out there who have worked all of their lives, and I'm trying to protect them and their assets, especially in these trying times. So we'll be talking about wills, trusts, estates, insurance vehicles. Just to let you know, we'll be touching on the very basics of Medicare, but as far as your selection of what sort of insurance, that is totally up to you. So to help me with this today, I have the lovely April. Welcome. How are you?
I'm doing just fine. Thank you for having me this morning.
Could you state your full name and your background for the record? It's like a deposition, you know.
Absolutely. My name is April Vasquez. I work closely, especially with seniors, into helping them come to a financial solution in financial vehicles when it comes to their retirement planning. And I have been in healthcare and insurance for the past 5 years, and I enjoy helping people have a better understanding, especially in times like this with healthcare costs increasing across the nation.
Do we expect an increase, say, twofold, threefold of insurance policies? I'm hearing rumors. I'm reading things. For the average working person under retirement age, have you heard anything about medical insurance going up?
Absolutely. Definitely this year going into 2026, we have definitely seen a huge amount of increases across the nation that has affected not just the seniors, but the regular population, especially for those under 65. That it's, even though it's through the Affordable Care Act, still is redeemed unaffordable, even especially in the employer side of things for that matter.
What could one do if, say, their policy tripled and they're trying to lower it down? Could they increase deductibles? Could they switch to what they call an HSA or what?
So there is options of that for HSAs. When it comes to that matter, they definitely can. When it comes to other vehicles, unfortunately, we have seen lots of people have to make the hard decision of either having health care or putting food on their table. So for 2026, we definitely saw lots of people just completely opt out of insurance in general, as that was going to be the best financial solution to their unique needs at home.
Backed against a wall, can you tell people what an HSA is?
So that's a health savings program that you're able to store money in, that you're able to utilize and pull out of it whenever you need for medical expenses to be deducted. So it's kind of from that perspective. And
it's paying like an interest-bearing sort of vehicle when they put it away. So it's kind of like you're investing in yourself, but if you get in hot water, you can need it. But man, what about catastrophic injuries? What could we do there? I mean, they're not going to be able to help themselves. They got $12,000 socked away, and they got a $400,000 bill.
Absolutely. So there is options in vehicles for plans that are redeemed affordable, but in reality, they are still on the high price side, unfortunately. With those high deductible plans, unfortunately, a lot of people are unaware that that's also including the prescription side. So here comes people using a catastrophic plan, but they still have the cost of medications. The catastrophic plan has a deductible of $12,000 for a single person. Family, it doubles and triples in that price, and you have to meet that deductible before you can even get your medications. I did see a huge amount of people face that this coming year for 2026, including in the past couple of months, and some of their medications alone are $800-900 a month. So they're kind of caught like a deer head in the sucklight of trying to figure out what they can do about medications, what can they do about seeing a doctor or doing whatever they need to, because at the same time, these are now put in place that it makes it hard for them to make affordable, just to get their basic medications, and people are having to choose between their health or their finances.
And these are the people that are making more than $20K a year, under $100K, the sandwich people that always get it, the middle class and the lower middle class. So what are we talking, run to the border, Reynosa Central for dental and medical and things like that? Or, I know people are doing that to get their medications because they can't afford it.
So there is different options. I know that for sure, especially in our office and other agents across the coastal bend in general. I'm pretty sure across the state of Texas that we are pivoting to try and find other options that are going to help our clientele. In that matter, there's other sources that we've ventured out to.
Thank God.
We've definitely gone through other forms such as the Canadian drugstore that we've been able to send some of our clients. They do it on a bulk, but they cover 75 to 80% of the cost of the medications. So that has definitely been helping. The cost of it's probably still more expensive, than what their traditional insurance would be, but definitely more cost effective than paying full price for their medications. But we have been transitioning to these different kinds of efforts to try and get everyone covered as possible, as it is important.
Well, and I'd like to take this second to shout out to my colleagues in healthcare, especially nurses that have taken to picketing and things. People say it's about their hourly wage. Actually, they were saying, you're paying us the same, but you're giving us double the work, and it's endangering children. It's endangering patients all around. So, when you have a CEO making 400 times what a nurse is making, we've got some really crazy problems in this country. But I'll get off my soapbox on that, but I wanted to say hello to everybody out there with courage and with conviction that they're fighting for patients over profits, not the other way around. So let's educate seniors on protecting their health and their retirement income. What can one do? So they've worked all their life. They've saved all this money. They may have an IRA, 401k. They may have a pension, but usually disaster strikes 60s, 70s. If you make it by then, your body turns on you sometimes, even with the most preventative measures of your own. What is out there to try to help seniors and protect their health and retirement income? Absolutely.
So, most important thing that a lot of seniors, the biggest mistake that they do face is not getting education early on. Early education on learning how to do this will help protect them, because they, like you said, they worked all their life, and the biggest fear that people have is outliving the money that they have saved. But of course, as you get older, your body starts wearing out and all these medical expenses occur. When it comes to the Medicare side, a lot of seniors tend to think that Medicare is going to cover a lot of the things that they need, but that's not always necessarily the case. And that's where the education of these other financial vehicles to help recover those expenses will be most definitely useful for them, but also, not just taking it on their own. They're not alone out there. There's definitely financial advisors, insurance agents, and, attorneys much like yourself to help protect it and have the best plan that is best and unique, customized for them, because everyone is unique. Every situation is different. We have things all the way from setting annuities, which can turn on a faucet, to have a stream of income. We have things all the way from long-term care, as Medicare unfortunately only covers a short-term
a couple of months.
A couple of months, and that's it. And then after that, what about if you need long-term care, you get sick, you have cancer? A lot of question is, what can we do? And lots of times, unfortunately, they wait too long into the very end till it's too late. And that's where, learning on about the long-term care policies that could help with those healthcare costs in the future. We have the annuity options as well. And on a very rare cases, some people, especially the baby boomers, aren't so very keen about it, but the reversal mortgage options, these are all tools that can be utilized towards protecting their income and their retirement that they work so long for, but still being able to get the stream of income, because unfortunately Social Security is not enough. And I see so many seniors, even at me being at the drugstore in line to get my medications. A gentleman one time was trying to get his wife medication, and he started crying because the prescription was $60 and they were on a fixed income and he just couldn't afford it. And it's different things like that being educated ahead of time will allow you and allow all the seniors to just get education early on, because it can be definitely confusing. There's always changes. Having the reviews is definitely something that needs to be done annually or semi-annually to make sure that everything aligns with all the healthcare changes that increase every single year and change.
On their benefits, yeah. And sometimes when you sign up for something, and I won't get into specifics, but it can be lifelong for the rest of your life, and you're locked in. So I know that what we're talking right now may seem a little bit nebulous or cloudy, but when we come back after a break, we'll be breaking it down for you a little bit more. And I also want to tell people the first step is getting a will, and that is not very expensive. However, a will, you have to get power of attorney, durable medical power of attorney, things like that. Let your wishes be known. We have so many people out there that say, "Me quieren matar o qué?" You want to kill me? You want to take my stuff away? You want me to make a will? And they don't feel like they feel their mortality. I get it, after 50. But we'll talk about that when we come back. Wills, trust, estates, spending down, income, doing some donative intent to children or charities or things like that while you're living, because you can't take it with you. The pharaohs tried it, took all their slaves and all their stuff, and how'd that go? Well, we'll be back after a brief break, and you're listening to April Vasquez along with me, educating you guys on how to survive in America with health care and aging when we come back. The details matter. Every person matters.
He is a straight shooter.
I love that he helps the community.
He's committed to his clients in a way that you never feel like you're being left out.
He applies the same attention, the same strategy.
Very smart.
Whether it's with their sons or daughters in trouble with the law, it's my clients who inspire me to keep pushing. I can't let them down. Hi, and we're back. You're watching South Texas Now on CBS, NBC, Telemundo. Bienvenidos a todos mis amigos que hablan nuestro idioma español. And also KTMV, Carlos Lopez, broadcasting the Ted Turner of South Texas. But anyway, let's get down to remembering what we're talking about. If you're just joining us, we're here with April Vasquez. Welcome back, April.
Thank you.
We were talking about trying to protect seniors and trying to protect and save your assets for what you've done all of these years. And let me tell you, it's like going to a stockbroker. Who gets it, right? So we're going to break it down for you on Medicare, how it works, and also in general about insurance and how to maybe shake loose some income you may not know you have or get you through the lean time. So welcome back, April.
Thank you.
All right, let's talk about seniors. We're talking about the exchange or the Affordable Care Act. The misnomer is Obamacare, but really it's more about making accessible health care. But now we're going to see sticker shock. Chickens have come home to roost, and there's going to be not only on that, but on taxes on your house and things like that. So seniors are going to get hit hard. So let's talk about how healthcare costs impact estate planning.
So when it comes to the healthcare costs, being financially sound and educated on your health actually affects your financial in the future. And that's the biggest, especially when it comes to seniors. transitioning from an employer benefit that they've worked so long for and they're entering retirement, or they're leaving the Affordable Care Act, transitioning into the Medicare world, the first thing that clients always come and ask is, how much is this going to cost me? And that's the biggest fear that they have. You know, they already have, of course, the regular Part B premium, which increased this year.
All right, so Part B is for hospital.
So Part A, so the general basics of Medicare, Part A is for hospitalization.
There you go.
And Part B is for your PCP diagnostics of that nature.
Thank you. And then we go to Part C, D, or...
Correct. So your Part D is your prescription plan, which is required by everyone to have across the United States. So you have to always for sure have your A, B, and D. When it comes to the C, there's two options that you can go to, and that's either the Medicare subplans, and those ones do come at a higher cost premium. And those ones, unfortunately, just varies depending on each person.
Got it.
But those are the more true, full-on health coverage option. But unfortunately, they're just so the pricing can be extremely high for some people, and each year it does increase anywhere between 4 to even 8.4%. Every single year. So for some seniors, that could be a huge financial, issue that they have for what they do have saved. And then the other option for your Part C comes into the Advantage plans.
Well, I always say, like, not to sound Machiavellian, but you only get good rates if you're healthy and not sick. Right. So
as we always say, your health is your wealth.
Yeah, that's right. And maybe and some people can't help it. They got a catastrophic injury. They got a catastrophic diagnosis. As a nurse practitioner, I've seen and had to tell people about those things, and it's devastating. Okay, so on estate planning and choosing your plan, I like to tell people that you can get on CMS.gov. That's the Center for Medicaid and Medicare Services. It's a treasure trove of information. CMS.gov. Educate yourself. And once you're over 50 like me, they start hitting you with AARP and stuff. That organization, it's not obligated to buy anything or insurance vehicles from them. They just got great information and for cheap per year. So those are a couple of, what other, information outlets would you recommend besides yourself, people calling you or that have a desire to learn more? Besides agents like yourself, what other outlets are there for people to learn when they're in their 40s and their early 50s?
Absolutely. So as you mentioned, CMS is definitely one of the top priorities. Even going to the Medicare.gov, going to the Medicaid, the Medicare, Medicaid.gov, which is also another outlet of the CMS that kind of gives more of the detail of it.
Thank you.
So that's a good round. And again, it's not going to a specific plan, but just a generalization of a robust of information. And my biggest one is your financial and professionals, as well as your estate planners and your lawyers, making sure that you have a sound of information and you have a sound, secure system in place for in the case something were to happen. So trusting your agents, trusting, your legal people are absolutely the best that you can go to and get advice from to make sure that you have something in place for them for yourself accordingly.
And ladies and gentlemen out there, people are, especially seniors and soon-to-be seniors out there, there are people trying to rip you off, man. Look into your IRS issues, if you have any, looking just to see about your bank accounts, and they're saying they're from the bank. There's a lot of scams out there. So who do we trust? And that's the beginning of it all. I know that in my profession, people can read up on reviews, look at people, see if they're licensed. And I presume, and I'm not an expert on this, for insurance agents, the same for you guys.
Correct. So you can definitely go to the national website, and we all have NPN numbers, which is our national producer number, and just make sure that they're qualified. And definitely go to the Texas Department of Insurance if you have any questions. Always remember to everyone that the government is never going to reach out to you via call or text message.
You got that right.
Everything is snail mail. And when I say snail, it's very snail mail. So if anyone ever has a question whether it's liable or not, definitely check your sources, such as the BBB. That's one thing to check, that if they're a liable insurance company, attorney of that nature. Going to the Texas Department of Insurance, definitely, I know they have y'all sourced for the attorneys as well. Making sure that things are equipped, because that is definitely the biggest factor, especially for those that are Medicare specialists like myself, is making sure that we protect everything when it comes to the seniors. It's a very, very strict, so many red lines that we have to make sure we stay in, because unfortunately they have gotten scammed so many times, and they unfortunately are the most vulnerable, and that's what we want to protect. So making sure that you trust the person, making sure that they come from a reliable source. Anyone calls you, definitely hang up, and you can call an outreach back, and whatever and whoever you feel comfortable with is the most important.
Yeah, and our Attorney General, too, has a consumer fraud division. The Texas Department of Insurance also, if somebody are running scams and you want them investigated, that's what they're there for. Great state of Texas. But also, I want people to know that there is a subsection in the bar of peers of mine that do elder law, guardianship, and things like that. So I want to underline, like from our last break, get a will, and that's the first step. Let your wishes be known. Don't just say it. Do it. And then also get a good, durable power of attorney that they can take to a bank. And you check with your bank, because sometimes they won't accept it. You're sick, and your wife or your husband is trying to get money out, and they say, no way. That's a problem. And then the other one is your medical power of attorney, whether you want, quote-unquote, heroic measures, be intubated, get all the works and do all the things to code you, as they say, and bring you back, or unfortunately not. So I've seen a lot of heartache there because of miscommunications. So getting back to it, let's talk about the importance of avoiding mistakes. There's common mistakes that seniors make when they're turning 65 or retiring. Hit it, April.
So the most common mistakes is waiting too late. Mm-hmm. I definitely see them coming in too late. They already turned 65. A lot of them, again, not being able to be educated early on causes the effect of them entering it too late, trying to have a better understanding. The number one thing is I have people come in all the time and say, this is just so confusing, I'm not too sure what to do. You do have... Seniors need to make sure that from the month that they turn 65, they have 90 days before their birth month and 90 days after to get into their Medicare and accept it.
And if they don't, what if they don't do anything?
If they don't do anything, then they will get penalized, and that penalization, the longer they wait, the higher the penalization will be, and that's not just temporary, that will be permanently for the rest of their life.
Al alba. Okay, everybody. 90 days before and 90 days after. And what happens next?
So after that, if they do miss that time period, they do have the open enrollment, which is usually from October 15th to December 15th of every year to go in and do that. So they won't have coverage until they do so. And that will be effective for the following year of the 1/1. There is a very strict, it can be so confusing for seniors, because so many seniors can at times be unhappy. Maybe the agent just didn't fully explain or see what their needs are. But I think the most important is finding an agent that will reverse engineer their needs, putting in their medications, putting in their doctors, making sure that they are fully taken care of and that it's beneficial for them. I've had so many people come in and they're trying to find a better plan, but we find out they have a chronic illness. There are specific plans for those that have heart issues, cancer issues, diabetes, that are rich in benefits, that are special and tailored to their needs. And I've seen so many agents overlook that and just put them into a plan. So having someone that you definitely feel understood and listened to is the most important thing.
Absolutely.
Because once you find an agent or an attorney or a financial estate planner that has a full understanding and truly cares about your needs, that's when you know that you're going to be taken care of. And that's why if they have an understanding, then they're truly going to care. You're just not a number. And that's definitely something that a lot of seniors feel, is that they're just a number. And they try contacting their agents afterwards and they just never hear from them again, unfortunately. So my advice is to definitely get the education. Definitely know that when it comes to 65, a lot of them are always on the edge of whether they should take part A and B, especially when it comes to they're currently still employed. So there's lots of rules whether their employer is redeemed affordable. So they can take Part B, or if they come from a smaller employer to where it is mandatory. So there's so many different options, but no matter what, at the age of 65, they have to apply for Part A. They will get penalized, whether you're going to continue to work or you are not. Part A is for sure the basic that you have to get when you turn 65. Part B will then, based on a professional that you sit down and speak with, will help you determine if you are ready to take Part B or not.
It's a lot of information, guys, and we've run out of time. As you can see, 24 minutes just flew by, but I want you to know that you can always call us, number down here. And also we mentioned CMS.gov, and then April also mentioned that there are subsections of that, Medicare and Medicaid.gov, which get into the meat and potatoes, and also AARP, and also the Area Agency on Aging here locally, and those are a lot of guys that watch out for you, ombudsman and other people. What's the magic number to call if people have a question for you, minus super stalkers and other people?
Mine is 361-854-9090.
854-9090, area code 361. Stamp it on your hand, write it on your hand. Remember that number, 854-9090.
Yes.
All right, we're out of time, but I want to thank April Vasquez. You've got her number, and it'll be appearing under there with also an email and appropriate information. Thank you all, and God bless.
You've been watching South Texas Now, featuring Joe A. Flores from the Flores Law Firm. For questions and comments, please call 361-887-8670 or visit floreslawfirm.com.